So I'm Dr. Christin Glorioso. I'm a physician and neuroscientist and entrepreneur. And NeuroAge is reversing brain aging in order to prevent dementia. The company is based on the last 20 years of my work out of MIT, and before that as an MD PhD student. And in a nutshell, what our company does is we have a test for brain aging that is multimodal and multi-omic, and it gathers data in early revenue for better Alzheimer's and MCI therapeutics and diagnostics. So we think of ourselves a lot like Tesla. So Tesla is selling cars in order to gather the data they need for better self-driving. We are selling the NeuroAge test for brain aging in order to gather the data we desperately need for better Alzheimer's therapeutics. And before I tell you how we're doing that, I'd like to tell you a little bit about why we're doing it. So these are my grandparents, and at the end of her life, my grandmother suffered with Alzheimer's disease, and my grandfather took care of her in the home. This had a really big impact on me as a child, led me to dedicate my life to coming up with better solutions for Alzheimer's. Now, unfortunately, it's in the next generation. My aunt is late stage with Alzheimer's. And I myself found out that I have one copy of the ApoE4 allele, which puts me at higher risk for Alzheimer's myself in my 70s or 80s. This is a really common story. More and more people are finding out their risk for Alzheimer's. There's a huge need for something that we can do earlier. And what my previous research showed is that if you can be 5 years younger in your biological brain aging, this is as assessed by transcriptome clock and postmortem brain, you're 6 times less likely to have Alzheimer's in the future. So there's a lot of criticisms of aging clocks. We did the hard work to really tie this clock to what we care about, which is risk of disease as well as functional outcomes. So these people also have better moods, better memories, less pre-Parkinson's signs. If you want to learn more about that, you can read about it in our publication. So you go to the doctor every year, you get your cholesterol checked for later risk of heart disease, you get your glucose checked for diabetes, but no one's checking your brain aging, even though it's the biggest risk factor for Alzheimer's. So we created the NeuroAge test for brain aging. It's super comprehensive testing. I think this is important because to get a really accurate picture of how people are doing with their brain aging, I really think at this point we need all of these pieces. So there's blood biomarkers, which is this brain-specific aging clock based on transcriptome that we created, plus brain MRI, plus cognitive testing online. You can play neuro games now. It'll give you a brain aging score just based on your reaction time and memory. We put that together into a super predictor using AI. It's already been trained on more than 500,000 subjects and is continuously learning. And we can give people a brain aging score. So this is Max. Max is 55. He has a NeuroAge of 51. He's 41% less likely to have Alzheimer's in the future than the average person his same chronological age. Now, no one would want this information unless there's something they can do about it. And for a long time, people have been afraid to learn about their Alzheimer's risk. But what we know is that it's about your risk of Alzheimer's is about 40% due to lifestyle. So there really are actionable things people can do now. We give people personalized lifestyle and health recommendations that are informed by our AI algorithms. They can come back, get retested, show that they've dropped their NeuroAge further. And if lifestyle alone isn't enough to prevent their risk of Alzheimer's in the future, they're contributing in a privacy-protected way to the data we need for personalized therapeutics for better FDA-approved drugs that will be waiting for them. So people often ask me, can you really reverse your brain aging? And I think the answer is absolutely yes. So this is a study by a friend of mine who's a radiologist. With just 25 extra minutes of exercise per week, people were able to increase their brain volume on MRI. So they're literally growing their brains back. This is N of 1, so take it with a grain of salt, but this gentleman has 2 ApoE4 alleles. He's in his 50s. He's very high risk for Alzheimer's, was testing positive by PET scan for amyloid. He underwent significant lifestyle improvement, got retested, showed that he was testing negative for amyloid, just with lifestyle. And then this was a study by Teen Ornish from last year that showed an 18% reduction in Alzheimer's cognitive impairment with lifestyle alone. So we have a beautiful client dashboard. If I don't say so myself, you can go and check it out at demo.NeuroAge. You can also play the cognitive games for free. There's a free month. This is actually my brain age, 37. I'm 44. So this was a huge relief for me to know that I'm younger than my chronological age on the brain aging test, and we hope to bring that to more people. We're sold in 13 private payer clinics and have launched direct-to-consumer sales. We launched in December. We don't need FDA approval, but we are seeking it to try to reach more people. We have funding from the Alzheimer's Drug Discovery Foundation and Gates Ventures to run a little clinical study for this. One reason we're very successful with chatting with private payer clinics is that there really is a hole in the market when it comes to brain age testing. So a lot of the folks we're talking to really don't have a viable alternative besides NeuroAge. There are people that are doing pieces of what we're doing, whole body testing, genetic testing companies, cognitive testing companies, and then overall biological aging companies like TrueAge. And then, of course, traditional medicine is reactive rather than proactive. And if you don't have a disease diagnosis, a neurologist will tell you there's nothing they can do for you. Our customers are really happy so far. We've been on podcasts for some of the physicians we're working with. And even one of our early clients wrote a blog article about us. We estimate the market to be about $2 billion for the test alone, and it feeds into the more than $25 billion Alzheimer's therapeutics market. We anticipate 5-year revenue ramping to $100 million with potential exits to big pharma or big health tech. We're an expert team with more than 55 years of experience. A lot of the AI algorithms come from work out of MIT with Sam. We also have a full stack engineering team and folks with expertise in partnerships, including from One Medical. We've so far raised $1.3 million, some venture, angel, and accelerator, including going through Berkeley Skydeck accelerator. And we're currently raising a $3 million round, and that's to get to $3 million ARR in the next 18 months to hire a few key hires and increase our marketing budget for events. And happy to take any questions.
One question here.
So you didn't show a study that you intervened and repeated the same data, and what did you get? You showed other who studied something. So you don't have that data, right? Am I understanding right?
That it's moving with intervention. So MRI is part of what we're studying, as is the cognitive testing. So we do know that pieces of the test, at least, are responding to intervention, but the blood test itself, we do not yet have repeat data. We're just getting that from our customers now and from the clinical trial.
All right.
Thank you. Hi. Do you have any pre and post COVID data?
For the blood, no, we're only 3 years old, okay. So yeah, we do not have that data. But we could look for data sets that already exist, perhaps. Are you looking to see whether COVID is aging people? Yeah, I would guess it does. We know it decreases gray matter volume.